Good afternoon. Welcome to our webinar, Envisioning Better High-Deductible Health Plans. My name is Melissa Gobnick. I'm with Commonwealth. We are going to give people a couple of more minutes. We expect we'll get started at around 2 past 2 because we can see that lots of people are still signing on, but wanted to let you know what's going on. Thanks so much for joining us this afternoon. We'll be back in a couple of minutes. Good afternoon. Welcome to our webinar, Envisioning Better High-Deductible Health Plans. My name is Melissa Gopnick. I'm a Senior Vice President here at Commonwealth, and I will be facilitating this afternoon's webinar. Thank you to all of you who have joined us this afternoon. To start with, we're going to just do the regular webinar logistics slide. You should see a questions box on your screen. We will be taking questions throughout the webinar, and then we'll also be pausing at certain moments and asking questions and polls and things like that. Feel free to put in questions throughout. If we can answer them in the middle, we will. If not, we will hold them to the end. If you're a tweeter and you'd like to tweet about the webinar, please do so using the hashtag BetterHDHP. On the webinar today, there will be myself, Melissa Gopnick, my colleague Amaris Kinney, a Senior Innovation Manager here at Commonwealth, and Catherine Hanneman from CHXD and Mad Pow. I'm actually going to turn it over to Catherine to talk a little bit about CHXD at this time.
Thanks, Melissa. So my name's Catherine Houtman, and I'm the director of Mad Pow Center for Health Experience Design. And what we are is we're a community of change makers who take a collaborative approach to improving health and humanizing the health system. We worked with Commonwealth on launching a design challenge that we'll talk about the results later in this workshop, in this webinar. But basically, the whole center is about building connection through community. We have an online group of people, over 500 innovators in health that can come together to talk. You can join at centerhxd.com. We also offer membership features, training, personal development, etc., to help build your capabilities. And finally, we look to explore partnerships and opportunities through projects. Again, you can learn more at centerhxd.com. Thank you.
Great. Thank you, Catherine. And I'm just going to spend a few minutes talking about Commonwealth. We are a national mission-driven organization. Our fundamental purpose is to create a stronger and more prosperous society where everyone has financial opportunity. We do that by building solutions to make people financially secure and also to put them on the path to financial opportunity and economic mobility. Our focus is on the financially vulnerable, and we define that as people who make less than the U.S. median income of around $55,000. Around 2 years ago, we started hearing from people we've interviewed that medical expenses were an increasing source of financial challenge. And when we looked more deeply at that, we discovered that a big source of that challenge was the increase of high-deductible health plans. Now, high deductible health plans were introduced with good intentions. People really thought that they would help change the cost curve of medical expenses, that medical expenses kept going up and up and up, and really were looking for innovative ways to approach that. And the thinking was that if consumers had to pay for more healthcare out of their pockets, kind of more like buying a TV, for example, that they would shop around more, and that they would not purchase unnecessary medical care. Insurers believed that, and so therefore priced the premiums lower, so employers and employees saved money. On paper, it looked like it could be a win-win for everybody. But what we now know is, in fact, that hasn't quite happened. We know that well-designed high deductibles, unless they are well-designed, I should say, high deductible health plans can increase the risk of out-of-pocket health expenses, which can lead to medical debt or foregone medical care. It can lead to missed work and lost productivity in the workplace. So this webinar is about providing new ideas, some of them that have already been tested by employers in the market, of how we can all work together to design good high deductible health plans that meet the promise of lower cost while still allowing for access to high quality care for all.
Great. Welcome again, everybody. As Melissa mentioned, my name is Amaris, and we really hope that you'll walk away today with some useful information. So our objectives are that specifically, we hope that by the end of the webinar, everyone has gained information as well as a lens for the needs of lower income employees enrolled in these plans. We also hope that by sharing new innovative approaches, you're galvanized to apply new approaches in your own work in this space. In a couple of moments, we'll figure out who's tuned in. I expect that many of you are well versed in high deductible health plans, but just to ensure we're all on the same page, that is what we're referring to each time you see HDHP, and we'll use that shorthand as well. HDHP is an IRS designation. So the IRS defines a high deductible health plan as any plan with a deductible of at least $1,350 for an individual or $2,700 for a family. And the way we hope to achieve those objectives is by taking you through this agenda. So first, relevance to different stakeholders. Why should you care? Where our insights come from. So what is the basis for the information that we're sharing? The bulk of the webinar will be about challenges and solutions, so what we've learned in terms of the challenges and what we've learned about how to address those challenges. And lastly, we'll talk about opportunities for action, how you all can be part of the solution. So we'd like to just start by getting a sense for who's on the webinar. If you could type in the chat why you're joining us and what your role in this ecosystem is, that would be great. And while folks are typing in their responses, I'll give you an overview of the main stakeholders for whom we think this content will be especially interesting. So there are a lot of different parties involved in the design and implementation of HDHPs, and all of them have a stake in making them better. Insurers are so crucial to this ecosystem as they structure the benefits. Well-designed high deductible health plans should save insurers money due to lower healthcare expenses and increased employee and employer satisfaction, resulting in retention in the plan. Benefit brokers are uniquely positioned to spur innovations because they're often the guides for their employer clients. And if they can guide employers to the right plans, they will retain happy customers. Employers are a significant channel through which we think American workers can be supported in their financial security or financial well-being, because as Melissa mentioned, financial stress impacts worker productivity and job satisfaction, and we know that financial worries are a significant driver of stress, as well as time off task because of the need to deal with financial challenges. High deductible plans not structured in the right way, again, will be one of the factors that contributes to financial stress. And finally, just as their name implies, health savings administrators manage and operate health savings accounts. commonly known as HSAs, which is also the way we refer to them throughout this webinar. HSAs, as I'm sure most of you know, are tax-advantaged accounts for which high-deductible health care plan holders are eligible. Without getting ahead of myself, we're going to touch base on how HSAs can be confusing and aren't well utilized in many cases, but they have great promise when designed to encourage savings. Improving savings rates and engagement is a win-win for HSA administrators and customers. And we've spoken to and worked directly with health savings account administrators, and we think what we share will be helpful to their product development. So with that, let's see who is in our webinar today. It looks like there are folks from a variety of fields, some benefits brokers, some employers. So hopefully we're touching on a bunch of things that are interesting to all of you. And now I'm going to turn it over to Melissa.
Thank you, Amaris. So the next section is going to be talking about our insights, where we came up with all of the ideas that we will be talking about later on in the webinar. But we thought it might be helpful for you to understand how we came up with the insights that we will be talking about. And there are kind of four main methods that we use. We started with some secondary research to see what other people have discovered about high-deductible health plans, and specifically for lower-wage workers. We then talked to consumers, lots of people who had high-deductible health plans, and then collaborated with Mad Pow on a participatory design workshop and design challenge. And we'll kind of go through and just give you the highlights of our findings from each of these streams of research. So to begin with, kind of our secondary research, we did a lot, but I just wanted to share 3 facts that were really foundational for our thinking about this work. So the first fact, and my guess is many of you have seen these, is that over the last decade, the average annual deductible grew 125%. So the amount of money that people have to spend before they're eligible to have their health expenses covered for most health expenses has grown exponentially. At the same time, what is interesting is that most Americans can't cover a $500 emergency. So they don't have the money in their bank account to cover this increasing deductible. Not surprisingly, given those 2 facts, in fact, almost half of people who are enrolled in a high-deductible health plan report that they skipped care due to cost. And another 40% report having some kind of medical debt that they need to worry about. So if you kind of take those 3 facts together, it's pretty clear that we need better designed high-deductible health plans if they're going to meet their promise of both being more affordable and lowering costs, as well as still providing access to care. When we did our consumer research, we both asked about what challenges people face, but we also asked about solutions, because we really believe that people who are enrolled in the high-deductible health plans may themselves have ideas about what's the best way to get them to engage. So we really asked them, what do you think would help you deal with the challenges that you've identified? Around 45% of the people we interviewed said that they were more likely to access healthcare more regularly if they felt their employers would contribute to their health savings and really supported them in this endeavor. We also asked them, how would you know how much to save? What would help you make that decision? And about 2/3 said that they would have saved up more money if they kind of had some way of predicting what their medical expenses were going to be in the coming year. And around 60% said some kind of personalized data to help them make that prediction would be incredibly helpful. So if they could have some sense of what to save, and that they knew their employer were their partner in helping them to save that money, would make a big difference in their ability to access care. So I'm going to now pass it back to Catherine to talk about the results of our participatory design workshop.
Thank you, Melissa. So here at Mad Pow Center for Health Experience Design, we partnered with Commonwealth to design a participatory design workshop. And what that means is we brought in the stakeholders in this, the people that actually are eligible for high deductible health plans that make less than $55,000 a year. And we brought in a bunch of people, 7 to be exact, to talk about their personal experiences, to kind of extract what their what barriers they have, what knowledge they need. And so we did have a bunch of insights after we did this half-day workshop, and some of them were very interesting, and we're going to share them with you. So first off is that what we learned is that for the target demographic, that selecting a health plan is an economic and emotional decision. So it's not just what can I afford. Sometimes you only get one choice through your employer. Sometimes you might have multiple options for a high deductible health plan, but it's not a logical choice. Some people just buy the cheapest one, or they look at it. There's a lot of emotions involved which make it a very complex decision. So for example, we had one person who thought there was a better plan, but it required her to switch her doctors. And as she put here in this quote, it's like, if I had switched plans, I would have needed to change doctors. I have a relationship and I wanted to stay with them. So obviously having a long-term relationship with a personal care physician, it's very important to people, and it's not just about the money. There is a relationship issue in here as well. The other thing that we really talked with them about the moment of open enrollment. And in general, a very consensus in the group was that it's like they're overwhelmed, they feel helpless, they can't even make sense out of anything. And as one person stated, it's like throwing darts to find accurate information. The brochures that they're getting from their employer or the plans just aren't clear enough. The websites aren't clear enough. They can't quite figure out how it all adds together. So they're just kind of winging it, which is, again, stressful, and they feel helpless at that time. So two other things is that we found they talked about was that high deductible health plans, they really may discourage necessary care. The copays are more expensive, so even just going to a simple visit is starting to get much more of a consideration for people. So they're avoiding just basic appointments just because the copays people can't just necessarily come up with $50 or $100 at a time. And that the other big thing, this was a really contentious conversation about the frustration of people, is that they don't really follow up. You go to the doctor says, great, now go get this blood test, go get an MRI, go do something else. And people aren't necessarily doing it because they do not understand how much that will cost. They've already paid for their copay, and now you're asking them to do something else, and that's even more opaque. And as one person said, that doctors have no idea how much stuff costs. They have an abstract notion, but they can't get into the nuances of things. And if people are really looking to their PCPs to tell them what this is, and is there a better cost effective, is there a better MRI place I should be going than the one in this building? So they're really looking for information that they're just not able to access. So based on this day workshop we did, we put together a design challenge with Commonwealth, and we launched it at Mad Pow's Health Experience Design Conference in June. And this design challenge was really targeted towards the financial healthcare and design community. And the prompt we put towards everyone was that, assuming a high deductible health plan option, can you design an innovation to improve the health insurance open enrollment experience so that it protects the financially vulnerable from hardship? So again, it was built on the information we'd gotten in the participatory design workshop, and we really were sharing all those insights and trying to open up to the community in the US to give us ideas on how to solve this. And so the biggest other insight we had in our workshop was that everybody focuses on open enrollment and designing an open enrollment experience, but the truth is people are constantly having to make choices and smart choices throughout the year. How do I use my HSA? How do I budget for whatever appointments I might have coming up? So based on that, we decided to split the prizes into 2 categories, which I'll go into. So the first category we had was Best Open Enrollment Solution. So at the moment of enrollment, can you design a solution that gives people the information they need to make the right decision? That we'll talk a little bit in detail about what these solutions that were submitted, but the winning prize in this one was by Tingy Meerkats, who was a group of students from UC Berkeley. They were both an MBA and MPH, and they did a really great solution about how to design a better open enrollment experience. And the second prize that we gave out was Best Ongoing Support After Open Enrollment. Again, it's that, how do I make those constant decisions about what doctor, where do I go throughout the year? And that was won by Care Collective, which was a consortium of people that in the healthcare industry. And again, we'll be going into more detail on what they submitted. We also had a few honorable mentions. First up was a product team from the company LifeSense, lifesense.com. They have a beautiful solution. Health First is a company that has worked hard to develop a better benefits program for their employees. And finally, Slalom Boston, a consulting firm, also submitted an outstanding solution. So if you want more information and to see the full details of everything that people submitted to the design challenge, it is posted online. There's a very long URL under here, but don't worry, we're going to send it to you in the email after this webinar, so if you want to go and get some more information. So thank you, and over to you, Amaris.
Thanks so much, Catherine. So the rest of the webinar will be largely dedicated to sharing with you some of the challenges that lower income employees face, as well as the ways in which the design challenge entrants conceived of addressing those challenges and other solutions we've learned along the way. So I'm going to just talk about the three primary challenges that we've identified. Based on the research that Melissa mentioned earlier, as well as the participatory design workshop that Catherine talked about, we learned a lot about what consumers enrolled in high-deductible health plans are facing. We think these challenges can be grouped into three major buckets: information overload, budgeting for healthcare, and confusion about HSAs. Regarding the first challenge, we see that particularly during open enrollment, when plan selection occurs, employees are faced with overwhelming information. This could be in quantity or in quality or both. One consumer in our workshop mentioned that you have to, quote, read everything, then you have to call someone to figure it out, end quote. So it's hard to sift through and know what is relevant to me as a healthcare consumer, what I should really know, and what will allow me to be both healthy and financially secure. One consumer in our workshop described looking for a clear understanding, quote, like a second part-time job at times, end quote, and that the decisions they make are, quote, an educated guess or probability of what I think is a good idea based on my gut instinct or rolling dice, end quote. We also heard from consumers that it takes a lot of effort to figure out what is available, what is covered, what is not covered. And these all contribute to the second challenge of not knowing how much to budget for healthcare expenses. Part of what those decisions during open enrollment should be based on is what one's likely healthcare expenses will be. But for a variety of reasons, including the confusion about the difference between coinsurance, copay, out-of-pocket, deductible, and other jargon, it's really hard for consumers to know how much they should have on hand to cover their healthcare expenses. And even if someone could anticipate all of their fixed expenses, they can't predict emergencies and don't feel equipped to make a decision about how much to save. And finally, speaking of saving, many employers try to offset the financial challenge of a high-deductible health plan by offering an HSA. But employees may not elect to open their account, they may not contribute to it, and certainly they feel ill-equipped to make the most out of it. Thus, the third challenge of confusion around HSAs. During the workshop, consumers brought up the lack of clarity they had around HSAs. One consumer shared by saying, quote, how do you take money out of an HSA? I don't even know. I never had to know it worked. While others shared about their confusion around whether or not funds rolled over and if money in the HSA could be used for non-medical expenses. So just a general confusion around HSAs. With that, we're wondering which of these challenges resonate with you. Please take our poll, which should be visible on your screen. I'm gonna wait for a second, give you about 20 seconds to respond. Great. It looks like some folks can relate to all of these. So about half agree with information overload, a quarter about consumers not knowing how much to budget, and about a fifth have confusion or can relate to this issue of confusion around HSAs. Thank you everyone for responding to the poll. So with that, I'm going to go into our first challenge, to just take these in turn and talk about the solutions as well. So as I mentioned shortly ago, the issue of how much information is presented and the manner in which it is presented overwhelms employees. Information is often unclear, it's hard to pick out what is relevant, and sometimes the volume of information means people don't even try to figure it out. We think that the solution to that challenge is to improve the open enrollment process and experience. And we think that facilitating a positive open enrollment experience will lead to more loyal employees who are financially better off, and we think there are several components of this. First, deliver the right information in the right way at the right time. So include only the information that is relevant to the decision being made at the time. Tailor information to employee needs. So personalize the information you're providing based on what is most meaningful to that individual, and consider both their needs as well as their preferences. Also link open enrollment to their benefits, for example, an employee assistance program or EAP. It's really important for some people that they have the ability to reach a human to help them answer questions they have about their health insurance options. We also think you can set up an auto enrollment or auto contribution mechanism, because taking away some of the steps in the process for the employee in a way that maximizes their benefit will help you and them in the long run. And finally, we think it's important to sell the HDHP program as a positive benefit. And this is particularly important for employers who have fully replaced their insurance options to offer only a high deductible plan. Make it robust and make it clear to employees why it's the best choice. We have an example a little bit later on of someone we think does this well. But to provide some other examples, one of our design challenge entrants, Slalom Boston, built an app called Wilbur, which is a good example of providing information in the right way at the right time. The app uses microlearning by presenting content in short snippets when it is immediately relevant, which makes users more likely to retain the information presented to them. It also has a live chat function, which is helpful for people that have questions they want to ask. Another solution is from one of our Design Challenge winners, Team Meerkats, as Catherine mentioned, and they created a solution called Plan Picker, which is a great example of tailored information generating personalized recommendations during the plan selection process. Plan Picker empowers employees to select the most appropriate health plan based on their needs and preferences. So we have a brief video clip to illustrate this concept that we're going to pull up on the screen in a second. And I'm just going to do a little bit of narration as you look at the video. So employees, with this idea of Plan Picker, employees complete a questionnaire about medical use, financial assets, and risk tolerance. It also adds in information about preferred providers and health conditions, and the information directs employees to the plan that best fits their health and financial needs. Plan Picker allows employees to search for plans based on what is most important to them. I think that was successful, so awesome that you got to see that video. And another challenge entrant, Health First, links open enrollment to other benefits, for example, their employer assistance program. So Health First is a large healthcare employer in Florida, and they submitted their redesigned open enrollment platform that allows employees to get recommendations based on past use, expected healthcare events, and the employee's budget. They also redesigned financial counseling services to directly address issues of choosing health benefits at open enrollment. We also wanted to mention a case study Commonwealth did about Atrium Health. Atrium Health is a large healthcare system in North and South Carolina, and they did a full replacement to a high-deductible health plan in 2016. They have done a great job of selling this benefit through a high-quality focused messaging campaign, through multiple channels to have their employees understand what it was, by compelling description of the benefits of the plan, and in general, Atrium just invested considerable upfront effort in educating their employees about the advantages of the new plan and how to maximize its value, including by taking advantage of incentives or other free money. Now, most people say they don't know how to predict what healthcare needs they will have in the coming year, and even if they did, they would have no idea what it would cost them. So moving on to our second challenge regarding not knowing how much to budget for healthcare expenses. I just do want to remind folks, if they have questions about any of the content that they're seeing or hearing, that feel free to type your question in, and one of us will either respond verbally or in the chat. So again, for challenge 2, the first solution we want to present to address this is providing access to personalized data. Adopt a tool that uses either an employee's own historic data or utilizes consumer-centric data to make predictions. When people don't understand how much everything, copay, deductible, prescription, and when they don't understand how much that will cost, there are a couple of ways of giving them insight to make predictions. Access to historical personal data and access to, quote, people like me data. So historical usage data gives employees a sense of how much they spent in the past. And people like me data is about relatable archetypes of consumers with details about their healthcare needs, financial situation, and other preferences, and describes their plan choice and decision-making process. So this allows an employee to identify with someone else and what they might need. So if I know that someone who is I'm a 50-year-old woman living in rural Iowa, what is a 50-year-old woman living in rural Iowa, has she spent on healthcare? And something like that would help me relate to it and have a sense of how much I might need to spend. One of our entrants we mentioned before, the Meerkats, they also included a video library in their plan picker to allow consumers to access stories about their peers and to help inform their healthcare selection. So this is an example of the people like me data that was baked into this solution. Now, the second challenge we think also has another solution. Access to historical and personalized data can be useful to help employees come up with an estimate of how much to save, but having that estimate might not be enough to get someone to take the steps necessary to accumulate that money. And it's no guarantee it's the right amount, because even in the best of circumstances, it's very hard to predict. So the other crucial solution is to help employees save by making it easy to do so. We think there are 3 ways to make savings easy. The first is linking to a product, for example, a health savings account. By linking to a savings product, you're ensuring that employees who might not otherwise have a savings vehicle have access to one. The second is to automate enrollment and contributions to the HSA. We mentioned earlier about the improving open enrollment solution, that one way to do that is to automate enrollment and contributions to an HSA. And it's also true that this makes it much easier for employees to save because they don't have to remember to set up or make manual transfers. And finally, have a premium differential based on income. Setting up the benefit so that the premium is not equal across the board, but lower for lower paid employees will allow them to more realistically see the savings from the decreased premium and put that into a dedicated savings account, which is a fundamental idea undergirding consumer-directed healthcare plans, which HDHPs are. And we do have one example of a company that does this. and I already mentioned them. That's Atrium Health. So Atrium tries to make it easy for employees to save by differentiating the premium amount. In their system, the percent of premium paid by Atrium depends on the salary of the employee. And they encourage employees to put the savings differential into an HSA. We believe that this practice is actually more common than it seems. Once we started asking whether employees were doing this, we've actually found that many do this but don't talk about it. For example, a large national financial services company and a health insurance company have both told us that this is in their practice to differentiate. And now I'm going to hand it back to Melissa to talk about the third challenge and its solutions.
Great, thank you, Amber, so much. So finally, challenge number 3, confusion about health savings accounts. I think all of our consumer research has found that the confusion is all over the board. Both it's about how you get money in, how you get money out, and what you can spend it for. And like any consumer-facing product, the health savings account really needs to be designed in a way that meets the needs of the consumer. And those needs are changing. More and more people expect all kind of web-based products to have some of the same features. So when we talk to folks about health savings accounts and what their needs were, there were 2 kind of big things that we heard about. One is simplifying the way to get money out in terms of electronic payment, and the other was making it simpler to get money in and adjusting those contribution levels. So in terms of electronic payments, you know, the world has changed around us. Fewer people carry around a big, huge wallet with 10 different credit cards in them. And most health savings accounts still require a physical credit card as a method of payment. This can be complicated, especially for families who may not have the card at all times with them when they have a medical expense. So simplifying the payment structure, which is much easier now with the changes in payment technology, is one innovation that we think is promising. Another, and this kind of builds on what Amber's was just talking about, that people don't know what to budget, and yet the way that most HSA contribution mechanisms are set up require you to set a certain amount and almost forget about it. That you say, okay, I'm going to have 25 bucks taken out of my paycheck, and the expectation is you can do that month to month. And especially with lower wage employees, that's really tough to do because that means they won't have that $25 if they need a new tire, for example, or if there's a big winter storm, which we here in Boston have just experienced, and your tire gets blown out and you need a new one immediately. You can't access that money. So it makes it much harder for people to put the money aside. So again, there's new technologies, payroll technologies, that allow for much easier changing of contribution levels. In the olden days, you had to fill out paper with pen and paper and then triplicate and wait 2 weeks before you could make any changes in your payroll. Nowadays, with online payroll systems, much, much simpler to change that on a weekly basis. So for example, General Wealth, one of our entrants, had a feature of a virtual HSA card. So you could go into your app and get a number, a credit card number that you could then give to someone over the phone or enter into a website that allowed you to, right in that moment, access your HSA account without needing the physical credit card. Another example, again from General Wealth, was that they allowed in their app for immediate adjustment of your contribution level. There's even another fintech that has started in New York called Alice, and they actually allow you to make the contribution to your health savings account after you've had the expense. Right now, the expectation is that you will put money aside before you know what your expenses are. But with the changes in technology, Alice has come up with a system that allows you go to CVS, you buy your prescription, Alice then sees that you've gone to CVS and bought a prescription, says, hey, do you want to take that money out of your HSA? And allows you to then, in your next payroll period, put that money into the HSA and then use that money to reimburse you for that expense. Really interesting, real time, making it much easier to use the account, especially for lower income folks who don't have the slack in their budget to put aside money ahead of time. And also deal with the issues that Amherst have talked about, that people just don't know how to budget or how much money to put aside. So the changes in payment technology and changes in payroll technology really have opened up huge opportunities for new innovative approaches to this issue of confusions around health savings accounts. Another major innovation, we think, is around how can health savings account administrators drive engagement. I've had many conversations over the last couple of years with HSA administrators who said, I have this beautiful website, tons of information, no one ever goes to it, with a level of frustration that is understandable. And so we think the more people engage with the health savings accounts, whether it's through an app or through a website, the more they will tend to use it. So clearly the fundamental, how do you drive engagement, is good design, right? I'm not even going to talk about that, that seems universal. But for low-income folks and for people who are having health emergencies, that is even more important, that the design is made to be really simple. When I'm worried about what's wrong with my kid, I don't have a whole lot of time to go through lots of complicated navigation. I want big buttons, easy visuals that'll help me understand what I need to do. And so simple, clear design is even more important for these types of websites. The other thing that we think is an interesting innovation is for health savings accounts to actually make it fun and make it easy to save. So I know traditionally it's employers who've provided match, receipts, incentivized contributions, but there's no reason why health savings accounts administrators can't do that as well. Whether it's simply for saving money into your health savings account or for contributions for specific health actions. We also think there's a huge opportunity to make it fun. We all know that when we're stressed, it's hard to make good decisions. And there's lots of research that shows that a gamified experience raises your levels of certain hormones in your brain that allow you to reduce your stress and make better decisions. So we really think there's opportunity to make better gamified experiences with these accounts. So some specific examples include Wilbur was an example from Slalom, Boston, that when you hit certain financial savings goals, you got rewarded with Wilbur bucks, which were contributions to your health savings account. Whether you reach financial goals or whether you went to your PCP annual checkup. So both rewarded financial behaviors and health behaviors. And this was within the health savings account, not sponsored by the employer. Another innovation was LifeSense, which is actually a real-world website, financial education and wellness platform. And they experience is gamified. And you can see there's a beautiful UX, and it really allows people to have fun. Who would have thought that was possible when making financial decisions? And, you know, some people have said, well, this shouldn't be fun. This is healthcare. This is serious. But in fact, people want it to be fun. We've heard this over and over from consumer research. The fun part of it makes it less stressful and more accessible. So it doesn't diminish the seriousness of it, just makes it more accessible to people to have a more gamified experience. So what does all of this mean? We have just thrown at you tons of information around different things, different innovative approaches that you might think about. And we'd love to hear from you now. Did any of it stick? If you had to think back to all what we've talked about in the last half hour, is there anything that you heard that stuck with you in terms of, that's an interesting thing. Maybe that's something I want to explore more fully. Just would love to get some first reactions. If you want to put that in the questions box. And I'm going to talk a little bit, as you can imagine, we've been thinking a lot about this and what we think are some opportunities for actions. And I'm going to give you some things to get you started thinking about areas you might be able to take action in. If you're an insurer on the call, and I see that there are a couple of people who are from insurance companies, you could think more about how can you make the offer of a high-deductible health plan more closely bundled with health savings accounts. I know many of you already do that, but in fact, in our research, we found around 50% of employers do not offer it as a bundle. And so it makes it incredibly tough for employees to save money. So if there's a way of making clear the benefits of offering the bundle, both health savings account and a high-deductible health plan, and really working collaboratively with an HSA administrator to really make that a one-shop deal for your employers. If you're an employer, making it easy, and I would almost say fun, to save, making it clear the importance of savings, and providing incentives, right? Lots of research that just even a small incentive, doesn't have to be a big match, a small prize or a seed can make a huge difference to people's ability to save. And as I said earlier, almost half of the people we talked to said that that would help them save. We've talked about adjusting of premium contributions based on salary, specifically important for low-income folks, right? For somebody who makes $50,000 a year versus $150,000 a year, contributing even $100 could be a big difference. You know, we've heard so many stories in the last few weeks about people living paycheck to paycheck, and we know that to be true. So if there's any way of adjusting premiums based on salary, that would be a huge important innovation for lower wage workers. And also more and more employers are offering financial wellness benefits, either through an EAP or through another platform like LifeSense or through other platforms. I've been hearing all the chatter in HR networks around the importance of financial wellness and understanding the impact of financial stress on worker productivity. And so there's a real link that can kind of double your money, so to speak, if you can link your financial wellness project with your health benefits and really make that a strong link, since they kind of reinforce each other. Financial stress causes health problems, and health problems can cause financial problems. So really linking those two together, we think is an important, easy way of innovating. If you're one of my friends at an HSA administrator, as I said before, contributing to and using the HSA easier for all employees, but also for lower income employees who can't necessarily make decisions around making contributions at the beginning of a year, for example, and who need some flexibility around that, and also need lots of options about how to get the money out. So not just a physical credit card, but other ways as well. And finally, if you're a benefit broker, I know a big challenge for you is always bringing the newest innovative ideas to your employers to make sure that they're happy and really are cutting edge in the benefits that they can offer to their employees. So we think there's a huge opportunity for you to bring some of these innovative ideas to both your employer partners and your insurer partners. So some of you have said things that you think might be interesting. Trying to go through here. Amrit.
Yeah, I think one of the questions raised was, have we thought about, instead of or in addition to wage-based premiums, have we thought about wage-based HSA contributions from the employer? And I think that's a really great idea that I just wanted to share with the group. That is another way that if you're an employer, you can think about modifying and designing your HDHP benefit a little bit differently. Maybe you do differentiate your HSA contributions to your employees based on the income that they're making. There are a few other questions which we can address at the end. So why don't we go ahead and go through, we only have 2 or 3 slides left, and we'll try to get in a bunch of these questions.
So next steps. Catherine, do you want to talk about Mad Pow, Centers for Health Experience?
Just waiting for my camera. So thank you all. So I run the Mad Pow Center for Health Experience Design. So Mad Pow is a strategic design agency, and this center is our health focused area. And what we do, a lot of different things. We can really help you with your design and innovation goals. So the types of things that we offer is design research. We do design strategy. We do, as we did with Commonwealth, we do design and innovation challenges. And we also help you design and build new offerings in health and finance. So that's our expertise. We'd love to hear from you and hopefully work with you at some point.
And here at Commonwealth, we would love to start a conversation with you. We're in the innovation business, and so we would love to work with you about understanding better the needs of your employees. We do a lot of consumer research, whether that's through individual interviews or through surveys, and then design something that works for you. We understand that everybody's a little different, but every employer, every health insurance company, every HSA, and really work hand in hand with you to design and then test and evaluate and see if any of this works for you. But now we want to go to the questions. Amrit is going to be our facilitator for this part.
Yeah, one question that came up was if there's anything that we could learn from usage of 401k websites and presumably apps as well in terms of improving utilization of HSA websites and apps. I think that's the question, but if I misarticulated that, the person that wrote it can write in. Go ahead,
Yeah,
Melissa.
I mean, I think this is a challenge that retirement providers have had for a very long time. I think the slight difference is that people who go to retirement websites are usually in a planning phase. They're in a headspace of thinking about their future. People who go to HSA accounts are usually in a place of stress because there's some health issue. You don't go to the HSA website unless you have some kind of health issue going on. So I think that that's a slightly different comparison. I think we'd probably compare it more likely with one of the medical providers' websites and innovations that they have in terms of improving usage. I think the big lesson to be learned from retirement is the biggest advance in the retirement field has been auto contributions. That is the innovation that has skyrocketed contribution rates is the concept of when you start working and you're first enrolled in a retirement plan, you have an automatic contributions, and you set it and forget it, and that has been the most successful innovation. And we do think there's a lot to be learned from that in terms of HSA, auto enrollment, and auto contribution. I love the idea. I see that someone has the idea of packaging together retirement and health savings accounts. That's a great idea. I know that Atrium Health did that. I think that's a great idea for people who are perhaps slightly older and more financially secure. For people who are still financially vulnerable, it's hard to think about the future when you're trying to deal with the day-to-day.
Great. Thanks, Melissa. And we have another question in your research and work, did you find any link between affordability and member satisfaction? I think one way to think about that is that both employers and employees will make it known with their checkbook, right, if they are not satisfied with the health insurance. So for employers, if they're getting feedback from their employees that they're not happy, or if the plan is not working in an efficient way in terms of cost and what their employees are getting out of it, then they're likely going to switch plans. And then specifically for employees, again, if they aren't happy with that health insurance plan, in terms of how a lot of that is often driven by the fact that they think that they can't afford it, or their employer has not helped them navigate a way to manage it so that they feel like they can afford it. I don't know if you want to add anything, Melissa.
Yeah, I mean, I think we haven't seen any direct research that directly links affordability and member satisfaction, but we've had a lot of anecdotal evidence around employees. In fact, now, in the last 6 months, there's been some new data around employers stepping away from high-deductible health plans. There was a really sharp curve of more and more and more high-deductible health plans, and we've just seen a little bit of a leveling off and a little bit of going down. And we think that's because employees, the promise of high-deductible health plans has not been met. They are not seeing cost savings, and their employees are more sick and not going to the healthcare, not going to the doctor, and therefore being less productive. And we have definitely heard that in all of our interviews with employers and with employees, that the high-deductible health plan, when it's badly designed, has impacted their satisfaction with their employer and also with their health plan.
Thanks. And one more question here. Have you seen a good example of health benefits explanation from a literacy perspective? I mean, one of our challenge entrants that Melissa touched on, the LifeSense platform, we think did a really good job with this in terms of having the information presented at a lower, essentially, reading level, so it reaches a broader audience, but also primarily gamifying the experience, right, so that people can actually absorb the information in a way that makes them want to continue to try to understand it. Did you want to add anything, Melissa?
Yeah, I mean, I wish I could say yes. I would love to be able to say yes. I go to this website; they've got this down. and I can't think of one. If someone else on the call they think their website is great, please let us know. We would love to know. We do think the concept of micro-learning and gamified and the right information at the right time. People are so overwhelmed. I know people get these like huge websites with lots of information that just doesn't apply to them. And with the new data technology and with AI, we should really be able to improve the personalization and making it the right information at the right time in the right way. We think there's huge opportunities there.
And I'll just provide one more question that we've gotten. Are there examples of employers currently auto-enrolling employees into health savings accounts, and what have been their results? Well, I just wanted to say that Commonwealth is an example of an employer that automatically enrolls its eligible employees into the accounts, who I work for, who Melissa works for. And that's because they also make regular contributions. Commonwealth is part of the benefits package. Some employers automatically open accounts on behalf of their employees, but the employees have to actually activate the accounts through the enrollment process. And because these accounts are relatively new, there are some legal hurdles that we're still trying to understand, including different policy at the state level, which means employers have been hesitant to embrace this. But we'd love to pilot with an employer if anyone is interested in talking to us more about this idea. And with that, I'm going to hand it to Melissa and Catherine to close out.
Great. Thank you all for sticking with us through this hour. We hope you have some new ideas that spark some interesting things for you to be thinking about or to talk to your colleagues. I will call this a success if you, after this webinar, talk to one person about one thing you heard today. I will go woohoo at that moment. So please let us know if that happens. We will be sending out a recording and all of the decks to you, as well as a short evaluation. We would love to hear if this was helpful or not. And please, we would love to collaborate, both Catherine at CHXD and Mad Pow and us here at Commonwealth, to really make high-deductible health plans meet the promise of providing affordable, accessible health care for all. Catherine?
Yeah, no, thank you so much for joining us. We had a great time working with Commonwealth, and especially on the design challenge. We learned a lot that really built on the knowledge we already had with insurance. So it was a really rewarding process. I'm so grateful that you guys have decided to join us. And as we said, in the decks coming your way, you'll see the link to the full design challenge, everything that was submitted by all the teams, including little video overviews. So there'll be a lot more information coming your way about the work that we did.
Thank you all.
Take care.
Thank you.
Bye.